Thank you so much. All right, I am just going to share my screen and get us going. All right. Hello and welcome to Disability Advocates Taking Action, or DisDATA. Ask questions, get data, and take action. I'm going to go to the next slide. So just really quick, we'll start with some introductions, and I'm going to go a little bit over kind of what the goals are, or our goals are, for the workshop today. My name is Lily Griman. I use she, her pronouns. I'm a project director at the Research and Training Center on Disability in Rural Communities. And I am a white woman who wears glasses in my mid-30s. I'm going to turn it over to Erin, who's going to also be presenting a little bit with me later, going over some of the amazing maps and graphics that we've been able to pull together through this project. So I'm going to let Erin introduce himself really quick and then get to the workshop.
Hi, everybody. My name is Aaron Leopold. I use he, him pronouns. I have brown hair, a short brown beard, and I'm wearing a black quarter zip. I also work at the Rural Institute, and I'm very excited to be here.
Yay! And we are so excited that everyone is joining us. It looks like we have a good number of people here. So again, welcome. We hope that in this presentation today that you will learn about our new collaborative Disability Data Advocates Taking Action. Gosh, I've said that so much in the past year, and here I am stumbling over it. Also, some information about how you can get involved to start asking questions and getting access to data and advocating for disability data justice. We're going to share a little bit about the advocacy efforts and the work that we've done over the last year as a collaborative. And then I'm hoping that at the end of this, you can start thinking about data differently and really recognizing that we are all data people. You don't have to be a data nerd, maybe like Erin or I, or anyone can be a data nerd. It doesn't require any special knowledge or training, and we are really here hoping to make disability data more transparent, accessible, advocate for those things, and advocate for representation across data sets and within data systems. So welcome. Those are broad goals. I don't know that we'll achieve all of them, but perhaps at some point. All right, I'm going to go to slide 3. So what is DisDATA? Well, DisDATA formed in the fall of 2020 in response to the countless disabled lives lost to the COVID-19 pandemic, particularly those in institutions and congregate settings. Our national inability to count those lives and prevent their loss exposes a long-standing issue that disabled people are missing from data design, collection, and decision-making. This problem is preventable through collective action. So we are a cross-disability national collaborative, and we are really committed to making data about disability equitable, actionable, and transparent. And one of our main goals from this group is also to start building a national network of people with disabilities, service providers, researchers like myself and other folks at research and training centers across the country and at USEDS to really ask the questions and define the variables, the measures that are really valuable to people in the field and people living their lives in the community or not in the community in institutions, and how can we really advocate for ourselves in that way. All right, slide 4. So again, who are we? Mostly, we're a community of people with shared values about justice, equity, and compassion. We're people who really care about this work, and data can sometimes be a little unfeeling or perceived as unfeeling, but it really matters, and people's lives are at stake when we talk about data. And so primarily, we are a group of individuals who have a passion for this. We are advocates and activists, service providers, researchers, community members, and people with and without disabilities. We aim to work in solidarity with all disabled people, disability-led organizations, and other groups of people who are systematically marginalized due to structural ableism and racism to collect the data needed to advocate for and affect change. So why data? Why does data matter? Really, data matters because there is power in data. I think this is something that we've really seen over the course of the pandemic, that as we've all been relying on data, I think, in a new way, maybe over the last 18 months. Data has come to mean a lot of different things, different people, and it has been pretty powerful, and I honestly think somewhat disturbing, perhaps, when you're looking at data and recognizing that these data that we see all the time really represent individual lives, and we're making decisions based on these numbers that we see that are real whole human beings behind them, and that also some of that data is missing, right? So not only do these kind of cold seeming numbers actually represent human beings, we are not effectively, or we are not counting everyone equally. And that really matters. And so we recognize that the power in data, really, we're asking that question of who is getting represented in data systems, and then why are some people being marginalized and excluded? What questions are being asked of data and these data sets, and of what questions are being asked in the world, and who gets to ask those questions and why. And this is really to reinforce, these questions are really about how data systems, data sets, data policy can be used to marginalize and exclude, as much as it can be used to include and understand. So really, there's this idea of good data, bad data, no data. Bad data is just as bad, if maybe not worse, than no data. Who gets to define what good data is? Who's asking the questions and defining the questions that get asked? Are the people who are being represented in those data systems the ones who are able to make the decisions about how those questions are asked, of whom and why? The answer for a lot of years has been like old able-bodied white men, usually. Now there's some white ladies in there too. And I think really, we as researchers, for me, speaking of as a researcher, and then as this broader collective group that cares about this, really have a role to play in starting to change that. So really, what we've seen through COVID is that disabled people are made invisible. We knew this before, but was really highlighted. That disabled people are made invisible across federal policy through the lack of data collection and representation, leading to a disability data inequity. This is particularly true in congregate settings. And I think it's important, I want to take a minute here to really talk about our definition of congregate setting, which is still pretty loose, honestly. We are still a very loose collective. We want everyone who's attending here to join and ask questions, and help us define all of these things and do this together collectively. But really, the best way that we've come to define congregate settings now is just a very long list of examples. So I'm going to read them now. So for disability DisDATA, we define congregate settings as nursing homes, licensed and unlicensed group homes, detention facilities, prisons, jails, detention centers, other carceral facilities, intermediate care facilities, long-term care facilities, regional centers, state hospitals, acute care hospitals, rehabilitation hospitals, psychiatric hospitals, veterans hospitals, hospice facilities, assisted living facilities without individual rooms, residential treatment centers, and then other congregate settings, because there are more. And really, I think having that broad definition is important because people with disabilities are disproportionately represented across all of these settings. And yet the data reporting systems and structures across these settings generally don't reflect kind of that shared experience. And it forces us into data silos where we're unable to talk about this shared disability experience across all of these congregate settings. And then additionally, and this has been a little bit more talked about, we have seen that disabled people are made invisible in intersectional spaces and identities through data. So data doesn't, a lot of the data that is available, particularly around the impacts of the pandemic, prevent you from looking across multiple groups of demographic identifiers or identities. So looking at the intersection of race and disability or of various disability types has become is nearly impossible. And that also forces groups with shared experiences kind of into data silos. So really, we are seeking data equity for disability justice, improved disability representation across all levels of data collection. What we're advocating for, and a lot of the work that we've done over the last year has been this, advocating for improved representation. Get people with disabilities, disability-led organizations at the table to assess how questions are asked, how surveys are implemented, and how and which data to use to inform policy. And also ask those questions of why aren't we asking certain questions, or are we asking questions in ways that could potentially be damaging to the community? So what do we do? This is where we're going to get into the really exciting stuff. We, so far, as I said, this is a really loose collaborative, and we really want more folks to join and ask more questions and share their experiences. But so far, we've been really advocating for disability data representation. Really getting the word out there that disabled people and disability-led organizations must be included across all levels of data collection. So two of the things that we were able to do over the summer was super exciting is DisDATA presented at the United Nations Regional Consultation of the Committee on the Rights of Persons with Disabilities back in June, where we really advocated for that increased representation and visibility and recognition of the impact that COVID has had on people with disabilities in congregate settings. We also were able to provide a public comment to the Biden-Harris Health Equity Task Force in July, which was a task force focused on a lot on data inequity, actually, around the pandemic. And there was a huge focus. There was some focus on disability. We had some other folks from the USED, other USEDs across the country presented on the disproportionate impact that COVID has had on disability. However, very little was discussed around individuals in congregate settings. There was some acknowledgement of the impact of COVID in correctional facilities, but surprisingly little on folks in nursing homes, which almost everyone in nursing home has a disability. And what we've seen over the pandemic in nursing facilities has been so horrific that it's disheartening, but also exciting that we were able to go and say, hey, this matters. This is how things have been really hard for us to understand what's going on and know the true cost the true loss of disabled lives over this pandemic. I want to say thank you to Mary for what she wrote in the chat. So we also more recently have analyzed data to support local and national advocacy efforts. And again, this is part of our goal as a collaborative where we want to connect advocates with researchers and connect advocates up with the data that they need to share their story and advocate for the things that are needed in their community. And this is one way that we've been able to do this, which is super exciting. So after this, I'm going to turn it over to Erin to walk you through all these amazing GIFs and images, and we'll do lots of rich description of them. But what we've done is a national analysis of COVID-19 deaths in nursing homes using data from the CDC and Centers for Medicaid Services. And we've developed a research brief to communicate the impacts of COVID on people in nursing facilities. And we've created these dynamic data visualizations at both national and state levels. We will talk a little bit more how these were used towards the end. So actually, if anyone is following along on the slides, slide 8 has now been moved down. So we're going to get right into the maps right now, and we'll talk a little bit about how Centers for Independent Living were able to use some of these graphics that we've created to advocate for change. And then ask, and we'll open it up for questions then and discussion then about how you and your center use data for advocacy or struggle to use data for advocacy. And thank you. Yeah, you said thank you again, Mary, for defining some of my acronyms. University Centers in Excellence in Disability is a use. Call me out, please, if I do that. All right, I'm going to turn it over to Erin now to go over some of these maps that we've created, talk a little bit more about the data, and play some visually interesting and also depressing graphics for you all. So let me turn my camera off.
Hello again. Thanks, Lily. So as Lily mentioned, the data we're about to see comes from the Centers for Medicare and Medicaid Services nursing home COVID-19 public file. This data is at the nursing home facility level, the individual facility level, and we aggregated it to the county level. For all of the maps we're about to see, the grayed out areas are areas with no data. As Lily also mentioned, limitations in data are important when thinking about data equity. An example of this, specifically with this data, is that only the included facilities in the CMS data are facilities that receive CMS funding. Because of that, it's kind of guaranteed to be an undercount of nursing home facilities. And this data is also dependent on the quality of reporting of each facility. 494 facilities that were listed did not report COVID-19 data, and kind of interestingly or anecdotally, 354 of the 494 facilities were in Texas. So take that as you will. So this graphic specifically illustrates the change in weekly COVID-19 cases in CMS nursing facilities by county over a period of 10 weeks from July 5th to September 19th, 2021. Counties are shaded from white to light orange to red on a scale from 0 to 797. White or light orange counties have fewer cases, and red counties have more cases. Counties for which we don't have data or where there are no nursing facilities are shaded gray. The first map represents the week of July 5th, and a majority of the counties across the US are white or light orange with 0 or 1 case. Over time, the clusters of counties all across the country grow progressively darker until the final week of September 13 shows considerably more of the country in darker red, with red counties in every state and some counties reaching levels up to 797 new weekly cases. Over the course of these 10 weeks, a total of 36,535 new cases were reported in nursing facilities across the country. And kind of while this GIF keeps playing, we'll spend the most time on this one. I kind of wanted to rattle off some stats that the CMS had listed. These stats were updated October 3rd, 2021. The first is 85.3% of residents in CMS facilities were fully vaccinated. With this, 69.2% of staff were vaccinated. There have been a total of 706,248 confirmed COVID-19 resident cases, with 137,678 total resident deaths. This is compared to 655,128 confirmed COVID-19 staff cases, with a total of 2,101 total staff deaths. We can move on to slide, I guess it would be slide 9. This graphic is similar to the last, but it looks at COVID-19 deaths in CMS nursing facilities by county over a period of 10 weeks from July 5th to September 19th, 2021. Counties are shaded from white to light orange to red on a scale from 0 to 59. White or light orange cases have fewer deaths and red counties have more deaths. Counties for which we don't have data, again, are shaded gray. The first map represents the week of July 5th, and a vast majority of counties across the US are white or light orange with 0 or 1 death. Over the time, clusters of counties across the country grow progressively darker until the final week of September 13th, which shows considerably more dark red and red counties in every state, with some counties reaching up to 59 new weekly deaths. Over the course of these 10 weeks, a total of 3,394 deaths were reported in nursing facilities across the country as a result of COVID-19. This 10-week time span was kind of chosen to illustrate the effect that maybe the Delta variant was having in CMS nursing facilities as cases increased throughout the nation. We can move on to the next slide, slide 10. This is a state level map we created for Pennsylvania, showing Pennsylvania COVID-19 cases in nursing facilities across the state, starting with the week of April 26th. A majority of counties are white or light pink, indicating 0 or few new cases, with some counties in the southeastern part of the state reporting more cases, which would be 29 to 88 cases. As the weeks pass, increasing numbers of counties across the state report increasing number of cases. By August 14th, substantially more counties report cases in the highest category, 29 to 88 cases. And we can move on to slide 12, or sorry, slide 11. Thanks. This is another graphic map of Colorado counties showing the increase in cases of COVID-19 in CMS-funded nursing home facilities over 10 weeks from June 13th to August 28th. Cases increased across counties steadily over the weeks. Over these 11 weeks, there are a total of 349 new COVID cases in nursing facilities across Colorado. So with these sort of COVID maps in mind, I'd like to move on to the next slide and turn it back to Lily so we can start a discussion on using data for advocacy. Thanks.
Thank you so much, Aaron. And I want to, before I get in a little bit to how these maps have been used by some CILs, I want to just address a couple of comments I saw already in the chat and in the question. So we'll have, we would love to make maps for people if they would like some. And we also have all of these maps available and these GIFs as static maps and also as the graphic image file. And have a link. There's a resource link in the page, our presentation page on the April website that will take you to a Word doc that's just filled with a bunch of different links for resources. And one of them is to a Google document with all of these maps. And we can also send individually folks the files if they reach out to us. Mary put that in the chat. That's great. Also, the comment about having Puerto Rico in the data, and I might have to have Aaron back me up on this because I'm not sure, but I'm pretty sure it would be great to have Puerto Rico, but we don't have data for Puerto Rico. So this is another good example of advocating for data access within these different data sets, is that often the things that we can do are really limited by the data that's available. And so when we start identifying where is data not available, and is this a place where we can advocate for increased and improved data, that's what we're here for. And that's what we want to start being able to identify. So these we were able to share and create the GIF in actually we have some more too for Illinois, New York, and Washington State, and on the through that resource link. And so we were able to support Centers for Independent Living in state and national advocacy efforts, where CILs were able to communicate state level disproportionate impact to secure funding streams for emergency transitions pilot programs, increased community awareness of the pandemic's effect on congregate settings, and to support current and future advocacy to increase access to HCBS, home and community-based services and housing. CILs used this to show the necessity of accessing state-funded housing vouchers for emergency transitions from congregate settings, and then used to communicate state-level disproportionate impact to advocate for federal emergency funding to be used for transitions and relocation out of facilities. And this is actually specifically some of the work that Misty and Dion and Marcy and some others are going to be talking about this afternoon, about the work that they have done in getting reimbursed, FEMA reimbursement for relocation, emergency relocation. And I have to say, we were able to present some of that data, Misty was, with support of DisDATA, to the National Council on Disability, really emphasizing the barriers that her center faced in accessing approval for FEMA reimbursement for emergency transition. And I'm hoping, I think she'll probably be sharing some of those slides that were really powerful way to tie data to advocacy. We were also, through this process of working with this data, identified major data limitations and discrepancies particularly between all the different data sources that were out in the world through COVID. We identified disparities and differences in COVID cases and counts between CDC, CMS, and state data, and really brings into question the validity and trustworthiness of this data. What we saw is that, and what I can say, and I think Aaron, I don't know if Aaron said it, is that really these numbers that we're looking at represent an undercount, if anything. Many state level sources, if you have access to that, and we can help support finding some of that. We also work with a partner, a DisDATA member at the Autistic Self-Advocacy Network, they have an amazing database where they've been collecting and really digging in to get more accurate numbers. But really, there's also that discrepancy is a real problem. There are deaths and cases going uncounted. And we know that, and we need to advocate for improvement around that. And that's been one of our focuses. Additionally, there's lack of consistency between definitions of congregate setting types across data sets. And that's, again, what Aaron mentioned. These are just CMS funded nursing homes. There was a long list that I read earlier of other types of congregate settings where we have really limited data. We're starting to dig a little bit into disability and COVID in congregate settings, in correctional facilities, but specifically those data sets are also disjointed. So we're talking about disjointed data within disjointed programs, where really I think we can come together to start saying, like, how can we start asking these questions and getting the data that we want across these different groups? All right. So yeah, I want to have a little bit of time here to have a little bit of a discussion and see if I miss anything. We can pause, maybe first answer any questions that are in the Q&A. I think maybe mostly things got addressed there, but please put any questions that you might have about the group. I'll switch to our next slide, our last slide, in 15 minutes or so you can be sure to get our contact information. I can put it in we'll put it in the chat also, about how you can become involved and how you can reach out for our technical assistance if you're interested in. But really wanted to open it up. Oh, although I see I have a question. This is from Ty Smith. I'm a huge data person and also a huge quality of life advocate. The Independent Living Center has been wonderful for promoting quality of life, but the behavioral health system, I can't get anyone to ask any quality of life questions. My question is, how can we tie in the behavioral system better to the independent living community? That is a really good question. And I actually want to open that up maybe to if there's anyone in the audience who could address any efforts that they've had locally. In many ways, my response to that would be that this is where a group joining a group like DisDATA, where we have a lot of different brains at the table, and identifying who are your local advocates too, who is the champion do you have a champion in your behavioral health system that you can go to? And how can we also, as researchers and data experts, find out what are the questions that folks can use? Where are the success stories of communities that have been able to tie and build relationships between these two systems? I'm probably not going to have an answer for a lot of these types of questions, but it's exactly the type of question we would want to put out to the group. So there's 126 people on this call. Someone's got to have something, right? So thank you so much, Ty. And I'm going to put the DisDATA email right now in the chat. It's disdata@meso.umt.edu. And anyone who's interested in learning more, getting involved, can email that email address. It's also available on the links as well that I referenced earlier. So I saw some questions coming in. I want to read these discussion questions. However, how does your center use data for advocacy? What data gaps have you encountered in trying to advocate for the needs of the community? And I think Ty's question is right in line with that. What are the barriers that you've experienced in trying to access or use data for advocacy? And again, I think that idea of competing systems and people in silos is a huge barrier that I optimistically like to think that collective action will be able to address. What are the risks associated with using data for advocacy? So as I mentioned earlier, there's definitely power in data, and sometimes that can go awry, right? And there are definite risks in highlighting certain types of data that can always backfire politically or ethically. So here I have something in the comment. The IL centers are cross-disability, as are Silks. When they do survey research, the number of people with disabilities and generic needs are counted, but these don't get broken down by access or type of disability. I think that is an excellent comment, and one thing that we're really hearing, and when we talk about data equity across disability and racial and ethnic lines, that being able to analyze at those intersections of not only accessibility needs, but also, disability for people of color who also are disabled, their experiences are much different and need to be able to be understood, right? And so when we have data that doesn't allow for that analysis, and that often is because sample sizes are too small. So whenever you have a group of people that is smaller than the general population, a smaller subset, data sets often do not gather enough information to do complicated analyses. And that is something that at the Biden-Harris Health Equity Task Force was brought up around racial health equity, and is something that we can advocate for as well. Increasing sample size, novel survey and analysis methods that allow us to really understand what those experiences are and prevent and not lose them to the numbers, basically. Yeah, this is great. We've got a couple other excellent comments. And Aaron, if you want to jump in, please do. No pressure. Anyone also, if they have questions and they want to raise their hand and come on audio, that's more than welcome. Yeah. Oh, go ahead, Aaron. Yeah. Oh.
Yeah. How do we do that? There we go. I can kind of jump in with the last part of Ty's question, which was, how do you try to do a positive data analysis with a weak community of support to make sure the data is helpful instead of harmful? And I think for us, what's really important is that we kind of are upfront and acknowledge all of the limitations that we encounter with our data. An example of this with the CMS data is acknowledging which facilities don't report, and also that this is just one kind of narrow view of congregate settings. It's not looking at a broader thing. So I think we try to be super specific. We list those limitations, and we try to make people aware of those limitations and how they might be best overcome. I think that goes a long way in sort of painting the whole picture. But maybe Lily, you could speak a little bit more to that than I could.
I was muted still. Yeah, I think these are the questions. I'm not sure that I honestly can. I think it's more that this idea of we have someone commenting about the barrier of people falling into a demographic black hole, right? And so if folks don't have a formal diagnosis, or depending on how questions are asked, people may not know how to answer that question, and may not then, their experience may not be counted because the question was poorly worded that they're asked on a survey. And then I think I like this term a lot, a demographic data black hole. I kind of want to steal that, whoever put that out there. And that can happen a lot, and I think is much more likely to happen when the individuals who the data represents are not involved in the process. So you will have bad questions that will result in bad data when you do not have representation of everyone at the table. So I think really thinking about how we can collectively advocate for improved representation. And these are the exact kinds of questions that we need to be collecting so that we can start to, as a group, identify like where are these key issues that we can really push and work with not only service provide like local level advocates, but national advocates who will know when, and people working at governmental agencies, policymakers, knowing when you can start to push for these changes. Here, where is our opening? And that's what's been really exciting about this group so far, is that you know, as representing kind of the researcher side of this, like I'm a data nerd. I want to dig up what data is available. I want to figure out how we can analyze it and create something that individuals can use. But I'm not the expert. I'm not really the expert in that, honestly. I'm also not the expert in policy or who to talk to or who is the champion or who, you know, that's where this collaborative effort is going to really come to play. And we've got a couple other, and I think actually I wanted to address, Ty had a comment also here around how do you try to do positive data? How do you bring data to the table to build a community of support? So there are few champions and people are exhausted in the world, as we know. Thinking about the poor public health workers of the country right now. And how do you start pulling data? And that's actually, I want to promote that question. I want to promote a presentation tomorrow that the RTC Rural is also doing around rural community development. And that's really around identifying those strategies of how do we identify local data, local level data, and local partners to really emphasize what we do have and how great the community is right now, but where the places are for change, right? And framing it that way. And there are definitely ways to do that. Generally, data is used to highlight disparity because that's what we so often see, but it doesn't have to be that way. And there are lots of kind of community development strategies that focus on that positive approach. So I think that's tomorrow at 11:30 Mountain Time. And I can't remember what it's called, the full title, but it's about a rural community development project, and I really want to plug that. So Raina, I don't know if you're on or if anyone's on who's doing that. Put your time in the chat. All right, I see another question. For the data of Kay says, for the data of CMS funding nursing homes, were there any efforts to break down data by different populations living in nursing homes, such as people with disabilities and elderly? Yes, this is a great question, actually, and it is something that that we are trying to take this as the Research and Training Center are trying to take some of our analysis to the next level and identifying specific demographics, not only about individuals within facilities, but facilities themselves. So do we see have we seen like worse outcomes in certain types of facilities and or amongst certain types of populations within facilities? And that is a challenging analysis because the analysis we're working on does not have that data. So again, an example of siloed data sets where data can often, I think, honestly be used to discourage, like non-experts from analyzing it. So we want to try to be here to try to overcome some of those barriers to start getting at those analysis, and would love to hear thoughts on that. Yeah, okay, some other great questions around, I would like to hear more about different intellectual disability facilities in the area of Atlanta, Georgia. And I think, yes, Ari, I'm not entirely sure that I'm saying your name correctly, but yes, please reach out through the DisDATA. Oh, I'll just go to this next slide so I don't read it. So again, the email is DisDATA, DISDATA, at umt.edu. Oh my gosh, I think I did that wrong. I think it's mso.umt.edu. I feel like we'll get that. Mary just put it in the chat, DisDATA at mso.umt.edu. Because one of our another member of DisDATA works at a University Center for Excellence in Disability at the University of Minnesota. And they have quite a bit of data on intellectual and developmental disability they have a big survey on different residents. I can't remember the acronym. Of course, this is a world of acronyms. But Ari, please reach out to me and I will get you connected with them. And that's another really exciting part about this project, is that there are a lot of different folks from different backgrounds, and we're coming together to share all of our shared information. Yeah. Oh, Amanda asks, what's the best way to know which data is worthy of being reported? That's an extremely good question. And I think really, really challenging. I think that's where I'm hoping that I think this is a group also that could potentially, we can all kind of build our data knowledge and data competency. It's not the word I want to use at all, but together to start understanding, how do you question data sets, right? How do you start to ask those questions about, like, is this data any good? And it's honestly going to be up to you. If you look into that and you say, no, this question is no good. It may be, you may have to compromise and say, well, this is the only data, but is the only data even worth reporting? It may not be. Yeah, and Peter asks about the data on the maps. Yes, it's all for this last year, 2021. Oh yeah, and I see Aaron is on top of that. Yeah, and this is another one. Access measures of people with environmental hypersensitivity are not reflected in disability surveys. And that's so true. And I think that's another way to start advocating around measurements and saying there is a community out here that is completely unrepresented, and what do we start doing? And what we start doing is collectively start advocating. Join our group. We're really we're really not super organized right now. We're getting there because we're doing this collectively and collaboratively, but we are, I think, in the next year starting a big push where we'll like have a website, which will be great, and have a format for people to join the group, and some really hopefully engaging strategies for sharing information. We have a Discord. Actually, we haven't used it that much, but we would love to hear from folks about what is the best way that you prefer to receive information. Is it webinars? Is it meetings? Is it conference calls? Is it listservs? Is it Slack and Discord? And we want to really make this collaborative really open and accessible and inclusive. Another big part, we're really hoping to push toward not only disability inclusion and representation, but in having that inclusion in data analysis, visualization, translation, data accessibility, usability, and transparency. And that's something we're hoping at the RTC side of things too, to help really push out and get access, increase access to those data sets in a way that's like understandable for anyone, because a lot of it's not. And then really pushing data equity for disability justice and trying to reach outside of the disability community, recognizing that intersectional component and that we have disability represented across all sorts of groups, and that there are shared goals and needs across those different groups. Yeah, and Mary said this, she just joined. We have a listserv or like an email chain that there's all sorts of stuff and that gets shared on it. And we would encourage everyone to just email DisDATA and say, hey, I just want to join. And I will add you to our group, and you'll start getting emails that you can ignore or read when they're relevant. It's, totally up to you. I know emails get lost all the time, but the more, the better. And then you have a place to reach out for technical assistance and things like that. And then another question from Peter, do you have data beyond congregate settings, and is it specifically focused on COVID? So this is actually great. I kind of want to put in maybe, or Aaron, do you think you could put in a link to the chat to the disability counts? The Research and Training Center on Disability in Rural Communities has a couple tools. We have maps on disability type for every state in the country across disability type, and then some subgroups looking at poverty, employment, veteran status, and those are available on the RTC Rural's webpage. And we also have a tool called Disability Counts that you can access to download data at the county level for your individual counties across those same indicators. So I think if you follow that link, and then the tool is called Disability Counts, and that's using data from the American Community Survey. It is a different data set, and we have some information on there around how disability is defined. It's very limited in a lot of ways as well, unfortunately, as all data often is, and so there's room to advocate there as well. So yeah, please check out all of those resources. And I think we have them also on our resource Word doc that you can download again. And then the gifts are also, if you visit the RTC Rural vendor table, which I encourage everyone to do, you can download our fact sheet on a couple fact sheets. Actually, we've been looking at this for a while. We have a couple fact sheets highlighting the potential risks that we put out back in like April of 2020. About nursing facilities, and then you can see we have this update of that, everything went there and then got bad again, and you can access that stuff through the vendor booth as well.
Lily, we do have a hand raised from an attendee.
Great.
Ty Smith, I'm going to unmute you so that you can ask your question.
Thank you, and I'll be quick. I was just curious if DisDATA is more than just COVID related data, or if there's other things. And I asked this because I was part of a group that did some research on, and I don't like this term, the high end utilizers, the 20% of the mental health population that uses up around 80% of the resources. It was huge, about 10 years ago, and then it kind of dropped off the radar. And I feel like, as I said, I'm a huge quality of life advocate. I feel like we can use that sort of data to make real good changes to help improve people's quality of life and access appropriate services and supports. But I can't find anyone who is interested in doing any research around that population again. And even though it's very much needed, in my opinion, perhaps now more than ever.
Yeah.
So thank you.
Yeah. Yeah, Ty, thank you so much. And no, we are not. And I think our goals are in the future not to be. I mean, we would just want to keep growing and identifying data that's needed, right? Any data that's needed to support the disability community and to support quality of life for disabled people in the US. I mean, internet all over maybe, but don't want to get too whatever. So I think Ty would love to hear more about that, is ultimately what I want to say. So if you want to get together and chat, or email that and join, I think that the more we get people involved, we can have work groups. We're at about 50. I think we have about 50 members right now. We want to grow, and then figure out what are people's interests and advocacy and passions, and get them together to start having these conversations and saying what's been done, linking up advocates with researchers who know something about that. There are some research organizations that I don't have on the top of my head that would be great to connect you up with, and see like what are these intersections, how are behavioral health and mental health organizations partnering with CILs, and where is that successful, and why and how do you get that information? Yes, and then Alyssa has a really good question around data collection for CILs. And that makes me think, again, Alyssa, I want you to reach out, because we have some resources that we could connect you up with. I know that we've done something recently, or are about to put out something around how centers for independent living can start to collect their own data. That's an exciting thing too, beyond the data that you get. We can also help analyze like national level PPE data. I don't know what that acronym stands for. The 704, the report, CIL reporting data. I think there are things that centers can do to start collecting that and defining your own measures, and then you can have your own data to share, and then advocate for that to be, this measure turned out to be really successful and great, and this is what we learned, and here's how we should incorporate it in a state level survey or a national level survey. PPR, thanks, Mary. Performance report something. So I think we're hitting the last 4 minutes. I don't know if I missed any other questions or comments, or program performance report. Thanks, Mary. Yeah, if anyone has any questions that I'm missing, you can also always yeah, let's see. I think there's some really great suggestions around how we talk about access returns, how we talk about disability. Oh my gosh, there's so many kind of quagmires and conversations also that we can get into, which I think is also really fun and exciting, and super important to have those questions, to have advocates having those questions, and then finding our routes to taking that information to people in charge. Okay, thank you so much. Erin, I'm going to turn my camera off so you can say goodbye. I think maybe we're kind of wrapping up soon. I guess it's 3 minutes early, so I kind of don't want to, I guess, rush out the door, but this was really, really fun. DisDATA, DisDATA at mso.umt.edu. Again, because I kind of can't believe I think I messed that up. Oh yeah, shoot, good. Here, we have a good comment. Susie, when you discuss data counts, would you consider saying, quote, these data reflect people with several specific access requirements, but do not reflect others. For example, answers by people with blank were included, but people whose disabilities blank access needs were not interviewed. I think that is an excellent example of the way that we can talk about and be incredibly clear with what data represents. And that's some of the hardest stuff actually with some of these, with some of the data sets we work with, is really understanding who is answering these questions. And these are some of those really critical questions that matter, that represent why disability representation matters, because you have to have people at the table when those questions are being designed in order to understand who is actually represented. And the truth is, we don't always know. We don't always have the best understanding with some of the data sets that we work with. And yeah, Mary just posted the evaluation in the chat, which is awesome. So yeah, I think that right there, Susie, is an excellent reason to get involved, is we need to hear what are the best ways to start answering these questions, and we need to engage in conversations about that. And I'm hoping that this group at some point can be a forum for that. And that we'll have a wide enough forum where folks with various different interests can come together and we can share what we're learning together, but also focus on the things that we're passionate about as well. That's what we've been doing. And what you're seeing here is kind of the results of Aaron and I being geography nerds. We're both geographers, and so we like to map data. And so a lot of the stuff that we've been doing now has been focused on that, but we do not want to limit it to that at all.
Lily and Aaron, thank you so much for sharing your knowledge and wisdom with us. Thank you to all the attendees, and please go fill out that evaluation and let Lily and Aaron know what a great job they did. And just a reminder that all recordings will be on the conference website, so you can refer back. Thank you so much.